which are specifically underreported, and especially when they are about vulnerable communities such as LGBTIQ people, older persons, and people with disabilities. These people and their voices and experiences have been invisible in media for a very long time. I mean, I can speak as a gay man in media. I have felt unseen in the stories that are written about and written by my own colleagues. So this roundtable is an opportunity to hear from experts and have a lively discussion amongst ourselves about what are the things that we don't even know about the sexual and reproductive health of a society, and what are the notions that we need to unlearn. We have 3 speakers representing 3 crucial communities which are often left out or are not fully understood in the context of sexual and reproductive health. Each speaker will have about 10 minutes. Speakers, please keep it to 10 minutes. And after each session, the editors and journalists present here will have the opportunity to ask questions for about 10 minutes. And then toward the end of the session, we have some free time to sort of engage more and learn. So without further ado, I hand over the floor or this Zoom space to Shobha Shukla for setting the context of this roundtable. Shobha is the founding managing editor at Citizen News Service, which is a citizen journalism initiative focused on health and science. She is also the coordinator of Asia Pacific Media Alliance for Health and Development. She has written extensively on HIV and TB, including HIV and TB science, non-communicable diseases, aging, and gender, among other issues. She is the recipient of the IAS 2019 HIV Science Journalism Fellowship, HIV Prevention Research Journalism Fellowship in 2018, and the AIDS Society of India's Presidential Award in 2019. I'm very delighted to invite you, Shobha. The floor is yours. Take it away.
Thank you, Ankur, for an introduction, which I don't deserve, I think, and namaste from India to everyone. And at the outset, I would like to thank Internews Health Journalism Network for giving me this opportunity to interact with this august gathering present at this roundtable. And before setting the context of sexual and reproductive health and rights on SRHR in our region, I would like to go back in time to 1945, when the United Nations was born, as governments did not want a third world war, and the countries rallied to rebuild a peaceful, just, and equitable world. Interestingly, one of the decisions the heads of the governments made at that time was to mandate the United Nations to advance work on addressing gender equality and human rights. Perhaps after experiencing the ravages caused by the Second World War, they had realized how essential gender equality is for a just social order. And so in 1946, the UN Commission on the Status of Women, or CSW, was established to promote women's rights. Since then, the Commission's efforts have resulted in several declarations and conventions, of which the Convention on the Elimination of All Forms of Discrimination Against Women, or CEDAW, is the most comprehensive document. It became an international legally binding UN treaty in September 1981. Another important landmark was the International Conference on Population and Development, Icpd, held in Cairo in 1994, where 179 governments adopted a revolutionary Icpd program of action that called for all people to have access to comprehensive reproductive health care, including voluntary family planning, safe pregnancy and childbirth services, and prevention and treatment of sexually transmitted infections. Then, in 2015, member states adopted the 2030 Agenda for Sustainable Development. And many of the 17 Sustainable Development Goals and 169 targets of this agenda are related to gender equality and sexual and reproductive health and rights. Well, it is now 75 years since the CSW was established, 40 years since CEDAW became a legally binding treaty, 27 years since the Icpd program of action was adopted, and 6 years since work on achieving Agenda 2030 began. But the ground reality does not present a rosy picture. And there is still a long way to go for our governments to deliver upon the promises they have repeatedly made to ensure gender equality and sexual and reproductive health and rights for all. Yes, the Asia-Pacific region has definitely made progress on some fronts. Over the past 20 years, the region has seen a 56% decrease in maternal mortality and an 8% increase in the use of modern methods of contraceptives for family planning. But significant gaps remain. There are still 140 million women with unmet need for family planning, which is still largely viewed as a woman's issue. And the programs are primarily focused on women, with little participation of men. Rates of male sterilization and condom use are dismally low, while there is more emphasis on female sterilizations. Moreover, in most countries, unmarried women and girls are excluded in the family planning programs and have little access to sexual and reproductive health services. Also, women considered older than reproductive age are excluded from most of the SRH services, including testing for STIs, even though they comprise 53% of the 421 million population of the region that is above 65 years of age. Little is known about their sexual and reproductive health demands, unmet contraceptive needs, and menopause-related problems. Despite child marriages legally banned in most countries, more than 33% young women in the region were married by the age of 18, and 12% were married by 15 years. A much greater proportion of females are married at this age than males, most markedly in South Asia, where 27% of adolescent girls are married, compared with 5% of boys, reflecting strong socio-cultural and gender biases that support early marriage and fertility amongst females. 1 in 7 girls in the region has given birth by the age of 18. The highest rates of early childbearing occur in South Asia, where almost 20% girls give birth before 18, compared with 7% in Southeast Asia and only 2% in East Asia, which is good. Early pregnancy, whether intended or unintended, is associated with poor maternal and perinatal health outcomes. Up to 63% of adolescent pregnancies in the region are unintended, contributing to a significant burden of unsafe abortions. There are an estimated 3.6 million unsafe abortions each year among women aged 15 to 24 years. Maternal disorders are the leading cause of death of girls in the age group of 15 to 19 years in the Pacific, and it is the second leading cause of death in South Asia. 25% women who are 15 to 24 years of age in South Asia and 17% in Southeast Asia have experienced physical or sexual intimate partner violence. Poor knowledge about menstruation, limited access to menstrual hygiene materials, and inadequate water and sanitation contribute to poor menstrual hygiene practices among adolescent girls in many countries of the region. All this, along with cultural and religious taboos surrounding menstruation, contributes to negative psychosocial and health consequences. This Asia-Pacific region is unique in the sense that while its economic development has been very fast, the age-old conservative and discriminatory norms and patriarchal systems are not changing, and they are reinforcing gender inequality and impacting SRHR in the region. Unless we address patriarchy and conservatism, we may never be able to fully deliver on gender equality. We know how to prevent STIs, HIV, unintended pregnancies, have safe abortions, yet we have not been able to optimize the use of these preventive tools. Having many prevention options will not be enough unless male, female, and LGBTQIAP plus people have bodily autonomy and are able to make informed choices. Let me take the simple example of the ABC approach: abstinence, be faithful, and condom use. This is an important HIV prevention approach adopted by many countries. But what about those who are not in a position to choose A or B or negotiate the use of C with their male insertive partners? Do we have enough programs that effectively address issues which do not let people choose A as an option to protect themselves from STIs or unintended pregnancy, or for those who cannot negotiate B or C with their partners? Simply expanding the basket of options will have less impact than addressing the root issues that do not let people choose even the existing tools. The old order must change, and not just through cosmetic and surface changes. The patriarchal system has to be demolished and replaced with a feminist system. Patriarchy fuels inequalities. Patriarchy is about the use of power to get more power. Feminism is about solidarity. It is about caring and sharing with others. Feminism is not about matriarchy. It is about having a socially just and ecologically sustainable order for everyone. We also have to recognize the fundamental value of life cycle approach so that girls and boys and all genders grow up with the core values of gender equality, human rights, and social inclusion to be better version of grown-ups than we are. A people-centric feminist approach is key to realizing sexual and reproductive health and rights for all genders. I believe that a world of solidarity is a feminist world where everyone, irrespective of their caste, creed, or sexual orientations, can have a dignified and respectful existence. To feminize is to humanize. Thank you for your kind attention.
Thank you, Shobha. That was really helpful. And it has really helped set the context of this roundtable and has given a broad landscape. And I really can't wait to hear from our speakers now. So I'd start inviting the speakers. Our first topic focuses on reporting about access to sexual and reproductive health for people living with disabilities and what issues remain underreported and misreported when we write about them. I invite Abia Akram to help us improve our reporting about disabled people. Abia is the founder of the National Forum for Women with Disabilities in Pakistan and the chairperson of the Asia Pacific Women with Disabilities United. She is also the chair of the UNICEF Global Partnership for Children with Disabilities and the Women's Coordinator of Disabled Peoples International in the Asia Pacific region. She was the first woman from Pakistan, as well as the first woman with disabilities to be nominated to Commonwealth Young Disabled People's Forum's coordinator. Over to you, Abia. I guess you're here, right?
Thank you so much. Thank you, Ankur, and thank you everyone for having me in this important platform. I congratulate for organizing this, and thank you. I think when we talk about the inclusion of persons with disabilities in the sexual health and reproductive rights, it's really important to see like what are the contexts and the difficulties and the challenges they are facing. I'll just briefly talk about it. Like 10 to 15% of the total population are persons with disability. 50% of them are women and girls with disability, and more than 80% are living in the rural areas. So they have very limited access to the facilities, to the services, to get all that information. And unfortunately, when we see like women with disabilities during the COVID response or during the pandemics and all that challenges and also the disasters, the discrimination created on a many of the levels. It increased on threefold or four times more. We also witnessed like they faced gender-based violence, they faced all the sexual harassment just because of unavailability of the services. The service providers are not that much aware how we can protect the rights of women and girls with disability, how we can create that infrastructure which is more accessible for them. For example, if they are talking with the government to the hospital, the ramps need to be there, there need to be infrastructural changes, the also the attitudinal barriers that exist in their lives. People don't want to talk about women with disability, they don't want to identify them, the data is very limited on them. And at the same time, if they talk about the sexual health and reproductive right, they thought like it's not that much important. So this attitudinal barrier is still exist on that. Thirdly, we also see the policies and the legislative gaps that exist in all the Asia Pacific, in the South Asian region, like how we can properly address in the gender and the disability both movements. The word women with disabilities and proper identification is not that much available. So when we talk from the journalism and also from the media perspective, this is really important to use the right terminologies like women first and then their disability. So women with disabilities and how we are providing that information to the wider. And secondly, we also thought like it's really important role that journalists and the media have to play is spreading the knowledge and information in accessible formats about the service providers. For example, a deaf woman is going to the hospital, how she is going to explain to that. So the media have very important role to play on that, like providing that information through the case studies, through the examples, so the service provider can also understand that this is the need and how we can make our services more exclusive. Police stations, departments, they all need to be aware about the rights of women and girls with disability. A blind woman, how we can handle that, a deaf woman, and then on the physical or the extreme level as the intellectual disabilities or the psychosocial disabilities, they are not able to share that experiences directly. So how we can provide that space and the safe space to them so they can talk about it. Fourthly, I feel like it's very important when we talk from the legislative perspective as well, like how we are translating that in easy to understand languages, so people can get wider like information and they are very easily like able to develop that strategies within their workplace, within their. We have seen like many of the forced sterilization, like Shobha ji just mentioned earlier, the forced sterilization of women and girls with disability is very common because the families are not getting the financial support. They have to go for the domestic work or all the support to the families to earn money, and then they have their own disabled daughters at home, so they are the first one who gets sexually harassed and they are not like providing those services. So they thought like this is the only solution, but we need the choices of women on their own bodies, on their own choice, like how they want to sustain with that, they want their own families, they want all that support, so we can provide that. So we need a collective effort to create that awareness and also some of the information about how we can give that and engage more visible voices of women and girls with disability. If they are not visible, they will not be able to talk about their rights. So yeah, thank you so much. And if you have any questions, I'm here. Thank you.
Thank you, Abia, for this really enlightening talk. I mean, there was so much I didn't know and have often overlooked. And thanks for keeping the talk short. You know, now we have more time for the Q&As. So I invite questions from editors or journalists present here. You know, you can just unmute or ask question, or you can just put your question in the chat box if you have any. We have about 7 minutes or something to take the questions, or you know, if you don't have, I have several questions, so I'll begin. Yeah, go ahead, please. Any questions from anyone? Just unmute or ask or put in the chat box.
May I ask a question? I'm Bharti from India. I'm based in the south of India in Mysore. And thank you, Abia, for a very, very interesting perspective that you've given us. You know, it's difficult for journalists to know everything about everything. So it's really nice being at gatherings like this. So you kind of concluded with a very kind of complex, thing where you said forced sterilizations, that women and girls with disabilities should have the choice on their own bodies. So I don't want anyone to misunderstand me on this question, but suppose we're talking about a mentally disabled girl who has been raped. Rape is bad as it is, and lands up with an unwanted pregnancy. So in such cases, is it not desirable that they are sterilized? I know it's a controversial question, but this has always bothered me, this.
No, thank you so much. I think this is really important question, because when we see the disability, it's not like all the disabilities have the same kind of like experiences. We know the psychosocial disability, we have few examples. When the disaster happened, a few of the women with disabilities, they were raped by the people who came to secure them. So in that situation, the mother was very concerned, and she reached out to us and said, like, this is third time she got pregnant and we don't want this to happen again. But again, there are the UN Convention on the Rights of Persons with Disability, in which they have the right of choice of the family and the woman as well. Because if you do the forced sterilization, that will, it's a loss for all of her life. It means like she don't have the right to have her own family, and how she can survive without that. So we definitely need to talk and consult with the families. We need to talk about it, but just to create that enabling environment. Because if you are also going in many of the places, there are some of the challenges which women with disabilities are not acceptable. So how we can create that environment which can respect their rights, their dignity, their choice, and the doctors need to be aware about it. Because sometimes doctors are just like, without any way, they just go and recommend that you can go for the sexual forced sterilization. So I believe that's not a solution, and it's not only about the psychosocial disabilities, because if they are psychosocial disabilities, then they have to go to the forced sterilization. Again, they are eligible to have their own family. So according to the legislation and the rights, this is their right to protect. The state responsibility to protect them. It's not like we cannot protect, that's why we are going for the forced sterilization.
Thank you.
Thanks, Abia.
Yeah, there is a question about Generation Equality Forum. Yeah, for the Generation Equality Forum, yes, I would say it was not completely accessible for all kind of disabilities. Even for us, it was very difficult to participate in that, because the systems they have used, it was not easily accessible for the blind woman, for the deaf woman, and there was no option for the muting the mic or unmute it. So the people like me, I was also part of the panel, but was not able to speak, because the sign language interpreter cannot mute their mics. And if they don't mute, then they will not able to listen. And the whole conversation was going just without any facilitation for women and girls with disability. So when we talk during that forum on the sexual health and reproductive rights, it was also mentioned very briefly about the rights of women and girls with disability. There were not that much mentioning of that.
Right. Thanks, Abia. We have, I think, time for one more question to be taken.
Yeah, I also got there. I think there is one question from Rita. Can you see in the chat?
Yes. I think it's a question of more of a comment, I guess, the problem with the media coverage.
Yeah, because we train the journalists on the disability equality trainings, because that's really important to understand the right terminology, to write using the right words and all. We do, like, where was on the International Day, they have invited 15 leaders with disability all over the country, and they were talking about the sexual health and reproductive rights of women and girls with disability. They were talking about their leadership role. And when on the day the report was published, it was like broken bodies but beautiful souls. So we were like how we can share that, even because this is not the appropriate wording used by any of the journalists, any of the media company, because this is really important for us. The words do this matter, and how we are using the terminology women with disabilities, women first, and then their disabilities, because that's our identity and we are really proud of it. So we definitely want to share that with the journalists, with all the like reporting, who are doing the reporting on disability, need to be interactive and also sharing their data segregation on proper information on that.
Right. Abia, I just had one question that I sort of wanted to ask, and then we'll go to Anjali, our next speaker. Is that, I mean, I've heard often that the people living with disabilities are seen as like asexual beings, like without any sexual autonomy by the society and the medical service providers. Why that kind of happens, and how can media help that correct that narrative? What kind of stories we should write so that narrative gets corrected?
Exactly, yeah, because they are the first one when we talk about their sexual harassment. The women with disabilities are the first one who get sexually harassed. But when we talk about their own families, their own like kids and all, so at that time people thought like they are not they have the sexual rights, or they cannot like have become mother or have babies or kids, or maybe they can also have that disabilities. So we have very good examples who are women with disabilities, who are married, who are having their own kids, and it's very different perspective, because disability and reproductive rights are not that much linked, because obviously because you're not understanding the gender role and the disability, we are segregating it. So it's really important to see first as a woman and then their disabilities. So if we accept that, then definitely we can create all that understanding and changing the mindset of the people that women with disabilities are also the women first, and then we can talk about their disabilities. Even for the severely disabled women, they can have their own kids, they can become mothers, because they have different roles to play. And again, it's all about the understanding of providing them the services to a proper way. It's just a different needs. So if we can assist them in that, that's
Right. That's very well said, Abia. I think what you're saying is that, the people really need to switch their mindsets. Like when we talk about disabled people, the disabled comes first, that frames the person. Now we need to put the person first, and the disability is just like an aspect, they're living with it. Right. Okay. Thank you so much, Abia, for this talk. Our next topic is reporting on policy and legal advocacy for sexual and reproductive health and rights, with a focus on LGBTIQA+ community. And with great pleasure, I invite our speaker, Anjali Gopalan, to talk about that. Anjali is the founder and executive director of Naz Foundation India Trust. As a strong advocate for the sexual health and rights of the LGBTIQA+ community, Anjali spearheaded the 17-year-long legal battle against Section 377 of the Indian Penal Code. In 2001, Naz filed a public interest litigation to decriminalize homosexuality and put an end to the archaic law under which individuals were harassed and discriminated against based on their sexual orientation. In 2001, Anjali was awarded the Commonwealth Award for her work with the marginalized communities. In 2005, she was nominated and shortlisted for the Nobel Peace Prize and became an Ashoka Fellow in recognition of her achievements as a social entrepreneur. She was named one of the 100 most influential people in the world by the Time magazine in 2012. Anjali was also awarded the highest honor by the French government for her work on lesbian and gay rights in 2013. That's a long list, Anjali. Over to you now. Please take it away. Anjali, you're here?
Sorry. I had forgotten to unmute. So I just started off by saying thank you very much, for organizing this wonderful event, because I think these are issues which are not easy to deal with. And as Abia was saying, it's a work in progress, I think, when I heard what she had to say, and it's so bizarre because you listen to this and you say, my God, when are things going to change, right? So, for example, when our understanding of gender itself, when we talk about gender, we mean women at the back of our heads. We try to change that, but that doesn't usually happen, and somehow it gets equated with women only. So that's the first battle, I think, people from the LGBTQI community have to really push back on. Because it's really difficult. It's how do you even start explaining any of this? And I know that with the reading down of Section 377, which is an anti-sodomy law, which interestingly, if you look at even the terminology, that if you have voluntarily have carnal intercourse against the order of nature with man, woman, and animal, you can be prosecuted. Nowhere does the term homosexuality get used. However, it was constantly used to harass gay people, gay men actually. And if you look at that, carnal intercourse, very Judeo-Christian terminology, carnal intercourse against the order of nature, which basically means if you're having sex for pleasure, or if you're having sex not for procreation, you're in violation of the law. And the courts nowhere have actually talked about it, but that's what it means in biblical terms. So for crying out loud, which one of us doesn't fall within the purview of that law? I mean, those of us who are sexually active or wanting to have sex, I mean, we're not wanting to have sex only for procreation. So it's really interesting to see how that was used to violate the rights of gay people. And thank God, that was finally read down to exclude consenting adults from of the same sex from the purview of this law. But that's all that's happened because it hasn't granted any rights to the community. So when we talk about sexual and reproductive health and rights, this community actually has absolute zilch access to any of that. Because to start with, our medical profession itself has no idea how to deal with any of the issues that people from this community bring up. So I suppose for lesbians, to some extent, they may be able to access some rights, some of these rights if they want, or some of these services if they want. But doctors are not trained to look at specific issues which affect this community. Take the trans community, take the Hijra community. Doctors don't know what to ask. Doctors don't know what to look for. When we look at men having sex with men, it's really difficult. Doctors haven't been trained to look at anal infections, for example. And these are things that people are really hesitant to talk to doctors about. Of course, there are no sexual health information that is shared with the community. Zero, nothing at all. Even when we look at issues like gender-based violence, we are not looking at this community. And just think, nothing made it more clear for us than what happened during this period of COVID. It really brought it to the fore, because what we saw was a number of people who had managed to get out of situations of violence ended up having to go back home or to go back to where they were earlier. And that's what had exposed them to that violence. So COVID kind of made it very clear to us that none of these issues have been dealt with. Now, what is very important, I feel, is the way in which the media reports any of this. Let me give you a good thing that happened. A few years ago, a journalist had reported how some doctors had advertised services around shock treatment for conversion to make gay people straight. And thanks to that, to our link up with that journalist, we were able to get the those doctors' licenses suspended for a short while. But they're back in business. But the point is, at least we were able to flag that issue and make sure that it got spoken about, and that doctors are a bit more careful. Does that mean any of this has changed? No. And therefore, my request to journalists to be on issues like this all of the time. Our biggest problem, I think, that many of us face especially, is when we look at the language that is used around any of these issues. So nothing is gender neutral. So even when we talk about rape, you have a large number of people who are outside the purview of this discussion totally, because there is no space to even report male rape unless it is in the context of children. That's a different issue. And thanks to POCSO, it's become a lot easier. But otherwise, impossible, right? I know over the years, I remember this, of course, this is a bit dated. I think things have changed a lot since then. But just to give you an example, a few years, maybe even 10 years ago, this was, there was a gentleman who was from the UN system who got murdered along with his partner by two men that they had picked up. And at that time, the kind of witch hunt that happened, the kind of language that was used in the media about these people, it was heartrending. But what was really scary is that it was really difficult to have a conversation which made sense with anybody. Our biggest issue at that time was especially how to deal with the Hindi media. This was. It had become really difficult. But we used that opportunity to actually be able to connect with journalists, out of which we spoke a lot about language, etc. And it was really helpful. So I do see a huge change that has happened from the time that we had started our work with the community. This I'm talking about 2004 to today. The way the media is reporting on LGBTQI issues is very different from the way it was earlier. But I think we still have a long way to go, because frankly, what sells is sensational reporting, right? And nothing, and there is something about this community which lends itself to that kind. It's very easy to do that kind of sensational reporting. So when we're looking at any kind of rights, because I cannot separate sexual and reproductive health and rights from all other rights which are completely denied to the community. Okay, the great thing is they're no longer criminals, but they still do not have any other rights that people in this country take for granted. So that is the long battle ahead, and that's where I see the media playing a very important and critical role. Because if we really want to ensure that the community gets the rights, including sexual and reproductive rights that is something that they should have access to, we need the media to actually step in and take it forward. Because I know this whole battle with Section 377, especially towards the end, the media have been a great ally. Therefore, I have a lot of hope. But I really think we also need to focus a lot on the regional media, on the language media. That is where a lot, I feel that's where there's a gap. That's where a lot more training and sensitization needs to happen. I also want people to understand that it's when we look at gender issues and when we look at the LGBTQI community, first of all, there just isn't enough information out there. And therefore, I think for people who are working with the community and for the community to engage more deeply with the media is becoming critical. And an example I can think of is the whole intersex issue. Not much is known. There's a lot of confusion between hijras and transgenders. We don't talk about lesbians at all. Of course, women, the sexuality of women really doesn't get addressed or talked about at all. And therefore, lesbian issues don't get talked about, again, except in the context of sensationalism. So suddenly you will hear of a lesbian couple that committed suicide along with one of the women's children because they couldn't deal with what was happening to them. And after that, there is this dead silence. We don't know what happened after that. We need to take it further. How do we do it? How do we sensitize people? So therefore, I think it's becoming very important for all of us to make a commitment to ensure that we follow through on what we start thinking about, writing about, and sharing with people. Because right now, I think we really need to form larger coalitions. Yes. Therefore, can the LGBTQI, and I'm talking about the community itself, we need to form larger coalitions with the disability movement, with the Dalit movement, with people working on property rights, with the media. I really think the time has now come for us to make a very conscious effort to work together. Thanks.
Thanks, Anjali. You spoke my heart. I was just like listening to you, and everything that I think about every day is what you said. So I'm very grateful. I'm from the community that you talked about all these really underreported issues in the media. I feel that the community is totally invisible. So without taking much, I shouldn't be taking more space here, but if there are questions here, we have time, about 5 to 7 minutes for questions. For Anjali, you can unmute and ask or put in the chat. Like always, I have questions, but you guys go ahead first. I just saw one question.
Yeah, could you just read that out?
Yeah, it's from Isha Hussain. Like you mentioned, that gender is almost always inevitably equated with women. The discourse around gender-based violence and sexual and reproductive health rights remains centered around women. As a result, the community has been continuously invisibilized in policies and the available data. What is the kind of reportage you think can help in expanding this discourse to be inclusive of the community?
Well, I think at least reporting on whenever you talk about these issues, to expand the definition becomes important. Or to even report on issues which have to do with the community without sensationalizing it. So, for example, when we talk, there have been issues around what's happening with the rape and violence that gay men face. Now, this is totally underreported. Yeah. So, and it really is heartbreaking because we have one of the most corrupt police systems in the world. So for gay men to first deal with them becomes a big issue. And then the space to even report that is not there. So they can't even go up. So therefore, I think it's a little, it's also about the fact that the laws don't allow for it to happen. So therefore, that's where part of the battle is. But I think journalists can really help by flagging these issues whenever you can. That's the only way to do it, I feel. Otherwise, it's going to be, how does one even start talking about these issues really is something that that is bothersome. Even though the Supreme Court, by the way, it was really interesting. The Supreme Court said that it is up to government to make sure that that we start sensitizing communities about these issues. But the fact remains, which means you have to start talking about changing the curriculum that teaches to include, that teaches teachers, that teaches doctors, to include, for example, to include LGBTQI issues. The curriculum that trains media professionals to include LGBTQI issues. None of this has happened, even though the Supreme Court talks about making it happen. So I really think as journalists, you'll need to start using every opportunity you can to talk about these issues.
Right.
Ankur, I have a question.
Yeah.
Ankur, I have a question. This is Jaya. I have two questions actually. One is, Anjali, do you see a discernible difference in the tone of reporting in the local language media in India compared with the English language media, in the way they supported your advocacy to decriminalize homosexuality? That's my first question. My second question has to do with another really interesting thing, which is observable in other countries, notably the United States, which is when you have people like Ankur, you have people from the community who are themselves accomplished communicators and who come out in the media and who sort of set the tone of the discourse directly. So you have that kind of authenticity with the community speaking its voice. And then again, they are portrayed as normal people, not primarily defined by their sexual orientation, but as someone who's a doctor or who's a engineer, or
lawyer,
someone who's a toddy tapper and absolutely having a lovely relationship with another man. I mean, these images of normalcy, do you think that that's the way to go? That's my first question. Second question on the difference between local language and English language. Third one is, we need more people from the community to speak, and how do we go about promoting that?
Yeah, no, I totally agree with you, Jaya, that we need more advocates from the community to start speaking about these issues. However, let me tell you, the environment is extremely hostile even now. So it's not that easy for people of the LGBTQI community to be out there talking about these issues. Now, recently, Saurabh Kripal his name has been forwarded to become a judge in the Delhi High Court. I was over the moon with that, right? Because finally something like that has happened. However, it was really interesting. What the media wanted to talk about was the fact that he was gay. That took over everything else, to the extent of forgetting that the man was also a legal luminary. He has a brain. He's a really bright, smart man. And you only wanted to talk about the fact that he was gay. So I said, look, I'm so glad that we do have an openly gay man who may be a judge someday. Fingers crossed on that one. But please understand that don't only see him as a gay man. Please understand that there are other aspects, which is why he's going to become a judge, right? So one is the expectation of society that people who are gay should be standing on rooftops and shouting out about their sexuality. All very well, but we're not asking straight people to do that. So I rest my case. Coming to the English and the language, and I can only talk about the Hindi language because I'm more exposed to it up north, is that there is a huge difference in the way most English media journalists report these issues compared to the way Hindi journalists write about these issues. I think part of it is the language itself, right? The way we write about homosexuality, for example, in Hindi, the language that is used is very different than what is used in the English media.
I think Anjali has frozen. Anjali?
Just messaging her.
Yeah.
Okay. And I think all of us are to blame for it to some extent, including people who are working with the community or who are from the community. A lot of our focus has been with the English media press, unfortunately. But I think that is slowly changing. And I don't know about the other languages down south, what's happening. But I know we are still having an issue a lot. The way issues get, the way stories get reported in the Hindi newspapers can still be a lot more problematic. The kind of changes we see from say 25 years ago when I started my work with the community to now, the way stories are reported in the English media, I think mostly it's extremely sensitive and very inclusive, a lot more than what we see in the Hindi press. So again, I think it has to do with the way we've also engaged with the Hindi press. One has to take that responsibility somewhere, I feel. A lot more work needs to be done with the language media.
Yeah, we'll work on that.
And yeah. And the third issue that you said about, what was it about the US? That you had a lot more people. Yes, absolutely. I agree with you. We do need a lot more advocates. We need a lot of people from the community to be talking about these issues, but with a very clear understanding that not everyone can do it, and there isn't a need for everyone to do it.
Right.
And I don't think we have to really be careful that we don't out people in any way, because the environment continues to be extremely hostile. I don't know what to say, but it can be quite dangerous for people from the community even today. You know, losing jobs, losing homes, getting kicked out of their homes still is happening. And we're in the 21st century. So it's not so easy for people from this community to take on the world. And therefore, larger coalitions and allies become very important. And I see the media as being able to be a great ally for the community.
Right. Thanks for answering those questions, Anjali. I agree with everything you say. But I think we should move to the next speaker, and then we'll have more time toward the end to engage more. Our third and final topic is about reporting at the intersection of ageism and sexual and reproductive health. I'm particularly interested in this topic because I feel I have no or very little idea about this, and I want to know what my misconceptions are, which I'm guessing are many. So I invite our final speaker for this roundtable, Sai Jyotirmay Racherla. Sai is the Deputy Executive Director of Asia Pacific Resource and Research Center for Women, also called as AERO. With a background in nutrition and population sciences and 18 years of experience working on Srhr, Sai's work spans activism, training, research, and advocacy. She has authored and coordinated a series of publications covering reproductive autonomy, maternal mortality and morbidity, sexuality and rights, poverty, food security, and Srhr. She is centered on women's health rights and works on pathways to universal access to sexual and reproductive health and rights in Asia. She has authored several publications on older women's health and well-being in Asia Pacific. Sai, please take it from here.
can't hear you, Sai.
Sai, are you mute? Can you check?
Now I am unmuted. Okay.
Yes.
So thank you, Ankur, for that introduction. And the focus of my presentation would be on older persons and looking at ageism and sexual and reproductive health and rights. And within ageism, I think it's a very broad concept, but the focus would lie on older persons' sexual and reproductive health and rights, because that is definitely an underreported area of work. The evidence for my work actually draws on the work that Arrow has done as part of the Icpd plus 25 work. So Icpd plus 25 is the International Conference on Population and Development, which actually situated sexual and reproductive health and reproductive rights in the UN language. And Shobha also talked about this. And as part of this review, which was done in 2019, Arrow looked at about 19 countries. We focused on different SRHR issues, and older persons' sexual and reproductive health and rights was one of those issues. In addition, in Vietnam, we had also done a specific study that was focused on older persons. So I'm trying to bring in all that evidence in order to share, and then let us look at what media can do in order to further the rights of older persons. Here we are actually talking about the perceptions and experiences of older persons themselves about their own sexuality. In one discussion, or in one focus group discussion, an older person from the Ho Chi Minh City in Vietnam, he has expressed that social norms consider men to never stop talking about sex, but then when it comes to women, women should not be showing sexual desires once they are, crossing the age of 45 or 50. And when they do so, then they would be stigmatized. Another experience has been around a woman who has actually said that at my age, it is quite shameful to go to the pharmacy to go and buy a lubricant because people would sneer at me and I would not dare to go and buy it. Also, I don't know what it is made of. If I use it, it is harmful, then it is no good. So this also talks about lack of information within this age group. And similarly, there was one another experience that was shared when where an older person, when they go for health checkups, the doctor asks, where is the pain? What do you want for us to check? But nobody asks, what are the sexual and reproductive health needs of older persons. So these are some of the experiences, and these are some of the perceptions that older persons themselves hold. And I am using the terminology older persons because this is the terminology that that is more value-free in comparison to elderly persons. So this is what we would also share with the media in order to use the word older persons. In the context of COVID-19 pandemic, there was definitely a huge volume of media coverage around older persons. But that was good on one front because there was an attention that was called for improved public health services. But the way older persons were represented in the media, that was amplifying ageism. And older persons were mostly projected as passive recipients seeking resources from families and from governments. And this was the perception, or this was the image of older persons that was projected. This neglected the autonomy and categorized all older persons as this one homogeneous group and who are dependent, again reinforcing this very, very unidimensional perception of older persons. Now, talking about older persons, why is it very important? Because if you look at the Asia and the Pacific region, based on the latest statistics in 2021, older persons, and they are defined as persons over the age of 60 years, they constitute about 651 million persons. Now, in terms of proportion, this is 14% of the total population in 2021. And if we see the same projections, this is expected to rise to about quarter by 2050. So older persons are a significant demographic when we are looking at the age structures. And with the Asia and the Pacific region, what happens is, if we look at the total overall world's older persons population, and here we have at least 80% of older persons will be residing in Asia and the Pacific in 2050. So that is the significant demographic that we are looking at. And how did we arrive at this demographic? It is because of this different changes in the age structures, whether it is the decline in fertility or the increase in mortality rate, and we are in a situation called the longevity revolution. But then when we're talking about this longevity revolution, this also goes back to what do we think about older persons, what do we feel about older persons, and how do we act towards older persons. And this think, feel, and act, these constitute what is ageism. And this whole aspect of ageism can be detrimental, and this is something that we need to look at and need to address, especially in media and in policy advocacy as well. Just to share, in terms of key trends in the region as well, we see that there is, and this I have already stated, that there is an increase in the proportion of older persons. Statistics talk about that, but also there is an increase in the pace of aging. And when I say pace of aging, it is in the past, like, it would have taken 115 years for a population to reach age society. But what we are seeing in this region, in many of the countries in the region, it is that in 25, in 28, in 22 years, we are rapidly growing into an aged population. And also, when you in certain countries, although the percentage or the percentage of older persons are less, when it goes to absolute numbers, that's a huge number again. And that's the reason why we cannot ignore the well-being of older persons, and including their sexual and reproductive health and rights. Going back to ageism, I mean, we've been talking about what is ageism, and it basically refers to the stereotypes. Now, I just said, how do we think, or how do we feel, or how do we act towards older persons? And this includes the stereotypes that exist, the prejudices that we present, and the discrimination towards older persons. And most of the time, we do see that media reinforces these ageist perceptions. And mostly we see older persons as burden. We see older persons as a very negative stereotyping, and with a very biomedical lens, as persons who are sick, who are with disease. And that perception, I think, should be changing. Another aspect that we all have in our perception is that older persons are a homogeneous group, and but then that is not true. And they come from diverse backgrounds, from rich societies, from poor societies, from different economic backgrounds, immigrant, ethnic minorities, persons of diverse sexual orientation and gender identities and expression, indigenous persons. So this image of older persons as a homogeneous group with a very negative lens is something that needs to be interrogated. And then just going back to some of the international commitments, because these international commitments are crucial for us to understand, because we can bring them back at the country level in order for our policy advocacy. And one of the international commitment is the Madrid International Plan of Action on Aging.
And many of the member states in our region have signed on to this. And it focuses on gender equality, on human rights, on fundamental freedoms of older persons, on eliminating all forms of discrimination, age-based discrimination, dignity enhancement, and elimination of neglect, abuse, and violence. So internationally, we have a very specific plan of action that is focused on older persons. This our countries have signed on to, which we can bring back at the country level in order to work towards policy reform and implementation pertaining to older persons. Again, I think there was mention of CEDAW, and when it comes to CEDAW, CEDAW is the Convention on Elimination of All Forms of Discrimination Against Women, and even within CEDAW, it is stated that concerns of older women should be integrated into the national strategies and development initiatives. These are some of the aspects, and CEDAW is a binding document, and this is something that needs to be taken into account. Not just that we are having specific international commitments pertaining to older persons, we also have, as Shobha has also talked, the International Conference on Population and Development, the Beijing Platform for Action, and very recently the Agenda 2030 for Sustainable Development. And all these documents actually have discussed aging in the outcome documents. But again, within these documents, I think one of the gaps is, again, the gender. And the previous speaker, I think Anjali, has talked about how gender is seen from a very women lens. And I think it is very important for media to look at gender in all its diversity. So these are different international commitments which we can draw on at the national level. And when media is talking about the issues, I mean, nobody denies that there are issues when it comes to, the health, well-being, and sexual and reproductive health and rights of older persons. But the lens that we need to take is not a very negative lens, but the lens we need to take when we are reporting is from a human rights lens, from gender equality lens, and that will help us address the problems that older persons face. And these problems include physical and psychological abuse, harmful traditional customary practices, lack of access to legal protection. They also include that in terms of demographics, we also see that women tend to live longer, and there is no other data when it comes to the diverse dimensions of gender. But when they live longer, they also have different morbidities, which includes urinary incontinence, different set of morbidities. And these morbidities are also as a result of discrimination that women face as a result of these lifelong experiences where they go through child marriage, whether they go through, difficult work, which results in uterine prolapse and different other reproductive morbidities. So these all aspects also need to be considered, and special attention needs to be given to women and marginalized older persons. Again, data suggests that 1 in 6 older persons, they experience some form of abuse worldwide. And the data aspect, I think this has also been brought up, and most of the time when we look at the demographic and health surveys, these demographic and health surveys actually gather data on sexual and reproductive health and reproductive rights to a certain extent. But then when they look at the categories of people, the age group is 15 to 45 or 15 to 49, which is problematic because then there is this perception that after 45 or 49, there are no sexual and reproductive health needs. And also, there are many other issues that older persons face. This also includes lack of pension funds, and especially in the informal sector where most marginalized older persons live, and their lack of access to pension funds is also a significant factor. I can share this PPT, but so some other aspects that we can also look at for media is to talk about good practices. Maybe in certain countries, there are like better practices in terms of policies, and these are something that can be highlighted in respective countries. For example, the Ministry of Health in Vietnam is having a comprehensive healthcare system, and a large number of elderly healthcare clubs are there in order to meet the needs of older communities. And maybe this is an example that we can take back at the country level in different countries in respective contexts. So thus far we have discussed what are the statistics around the older persons. We have also discussed what are the issues that older persons face when it comes to health, well-being, and their economic security. And the recommendations to the media is, maybe in the first place, we really need to address the stereotypes, the prejudices, the discrimination that older persons face, and that can come from how media projects older persons from a very affirmative lens. That is something that needs to be taken into account. But also this whole myth busting around sexuality, that it is up only until a certain age, and then sexual relations do not take place after a certain age, and highlighting sexuality as an important factor that influences quality of life is something that needs to be taken into consideration. And this whole life cycle approach is something that is very important to talk about. And also when it comes to public health interventions, whether for gender-based violence and for HIV, we need to take a holistic concept into account in terms of sexuality, sexual agency, and activities of older persons. And then whenever there is research that is being done, this research needs to take older persons' age group also into account. And then some of the other recommendations that have come out of this study also include call for health and social long-term care systems, and high quality integrated care is something that we can look up towards for older persons. And when we look at this whole disease perception, okay, we talk about hypertension, we talk about diabetes and other diseases, but then when older persons go to a health system, why are we not talking about their sexual and reproductive health issues and sexual and reproductive health and well-being? So this is something that needs to be taken into account. Data gaps are also something that is very crucial because once we know the data, then we know how to make an intervention. So that is important. Older persons in all their diversity is something that needs to be recognized. And finally, we talk about comprehensive sexuality education for young people, for children. I think comprehensive sexuality education is something that also needs to be included for older persons. And there needs to be quality information when it comes to sexual and reproductive healthcare needs for older persons. And media can highlight all these issues. Thank you.
Thank you, Sai. I see so many stories there that can be written about older people. We are running slightly behind, so we'll have about 5 minutes or so to if people have questions related to what Sai spoke about. I already see one question, which is interesting, and then Anjali added to that. This is from Bia. She's asking, what about the term senior citizen, which is often used, for example, in the US? Is that inappropriate? And how can we change the narrow definition of Srhr as focused on reproductive only? She has third point on this. During COVID-19, older people are presumed to have underlying conditions and more at risk to die from virus. Though this is true, do you think it is again stereotyping the older people? Yeah, so it gets at ageism. So unmute.
So in terms of the terminology, the language that can be used, there are different terminologies. We can, elderly, older persons, senior citizens. In 1995, at the committee of the Economic and Social Council, the language is very important. And this was discussed, and older adults themselves said that we would prefer this language of older persons, and that is the language that we would want to use. So this is coming from the community. That would be the preferred language. And I'm trying to look at the other questions. Senior citizens, we have addressed.
Yeah, like during COVID-19, older persons are presumed to have underlying conditions, more at the risk of dying from virus, but that kind of, how to get around the ageism part when you're writing about older people. Yeah.
Yeah, and then, I think I'll also talk about the other point that was asked around narrow definition of SRHR. Actually, SRHR is not a narrow definition, because sexual and reproductive health and rights includes sexual health, reproductive health, sexual rights, reproductive rights, and sexuality in all its dimensions. So definitely SRHR is something, it is beyond reproduction. And then COVID times, underlying conditions, yes, the underlying conditions actually do aggravate the condition, and more at risk of dying from the virus. Do you think it contributes to stereotyping? So definitely there is stereotyping that exists. And when it comes to, of course, the underlying conditions, and especially when it comes to underlying conditions that are around respiratory tract infections, that again puts you at risk of death and disability. So, but then overall, we do see that in older persons, of course, there will be some kind of immune system, which is like, compromised to a certain extent. And when a new virus attacks, then you are more at risk. So that definitely needs to be taken into account. And we need to see, but how far it is the only reason or for stereotyping, that is something that, it really has to be thought about. Menopause is such an underreported, totally agree with you, Bhanupriya. And, as a result of menopause, there are so many other risks and so many other health conditions. And also it impacts on the sexual relationships. We have seen situations where, older persons are, they are not able to express their sexuality. They are having difficult relations with their partners as a result of menopause. And that's why, the whole point of some kind of sexuality education becomes very important, because as we grow, we ourselves don't know what is our physiology and how do we better manage our physiology in order to, ultimately express our sexuality in the way we would want to. So that is agreed with you.
Right. I'd also agree on that point. And like, I'd openly say, I have no idea. Like, I would like to read this story about menopause in older people. So yeah, this is definitely an underreported issue. We are running, there's so much to talk about, and we are running close to the timeline. And I wish we had more time for discussion, but we'd send all the slides and the contact details of the speakers so that journalists can reach out and interact. Before I give the floor, the Zoom space to Jaya for final thoughts, I'd ask all the participants here to just take like a couple of minutes to fill out a super quick feedback, which is really important for us. It's super easy, just like less than 5 questions. It won't take even a minute. My colleague Mohammed would put this in the chat, and so that you can sort of just like click on that and fill out the feedback. Now over to Jaya for the final remarks, the famous last words. Go ahead, Jaya.
Famous last words. I think it's remarkable that everyone stayed engaged for the whole hour and a half. I didn't really notice the time passing because of, the weight of the issues I think that were aired here. Plus, I think there was, it's fairly bristles with possibilities, this whole terrain. It's full of ideas, full of hope, and full of work that needs to be done by the media. And I really think that two or three of the important points that have come up have helped improve our own understanding of ageism and what it has to do with Srhr, the kind of civil rights advocacy that needs to be done, and the kind of level of engagement we need on the part of journalists, not just to understand laws, understand policies, understand the way we need to frame issues and present them, the need for the community themselves to be more visible, to become more visible in the media, and to visibilize their world in a better way, to sort of normalize and mainstream it. And I think Abia's points about disability and women, again, such a huge challenge, many, many mountains to climb, I think, but with such a remarkable and stellar group of all women speakers, might I add. Again, don't want to sound gender discriminatory, want to move away from that. But what I'm trying to say is the kind of passion that is being brought to this field, I think that passion needs to spill onto the pages of our papers much more than is happening now. So here's to more data, better research, better framing, better angles, and more inclusivity, I think, in all of these issues that we're talking about. I'm going to very quickly extend a huge thanks to all of our panelists and our wonderful moderator for making this discussion really come alive and put so much of heart into it, which I think is really key. And I'm going to ask my colleague, Abia Akram, who heads up the Health Journalism Network, to sort of sign off on this, but also extend a huge thanks to Citizen News Services and Shobha Shukla for, involving some very fine people around the table and for her remarks. So, Abia, you want to sort of say the bye-byes?
Sure, Jaya. Thank you so much. Thank you, everyone, for sticking around, and thank you to all the speakers and to Ankur for moderating and facilitating this conversation. Really appreciate it. I think there's so many ideas. I myself, just listening to you all, have been thinking at least of 4 or 5 stories in my own head if I had the time. So we also have some grantees here from the Srhr story pitches, and I hope that they're going to be working on stories in this month. So maybe they can factor in some of these perspectives in their own stories. So thank you very much again. Thank you, Shobha. Thank you, everyone, Anjali and Ankur, everyone. Namaste from the US.
Namaste.
Please fill out that feedback. Please fill out that feedback form.
Yes, that's right.
Yeah.
Make Mohammed happy. Thank you.
Thank you, everyone, for coming.
Thank you. Bye-bye. Bye.
Thank you.
Bye, everyone.
Thank you.
Bye-bye. Bye.
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 So who's on the chat? Thank you, Ankur. That was
I'm here.
yeah. I think
Yes.
everyone enjoyed themselves, I think, and that's really key. Kalpana, thank you for being with us. And Bharti,